Are healthcare admin jobs toxic? This is a very common question among doctors, nurses, and healthcare professionals in the UAE who are considering moving into non-clinical roles. Many people assume that administration automatically means less stress, better work-life balance, and a more stable routine. But the real situation inside hospitals and clinics can be very different. Across the UAE, many healthcare professionals start thinking about administrative roles after a few years of clinical work. Doctors, nurses, and allied health staff often look at hospital administration, operations, or coordinator roles as a career shift. The main motivation is usually to escape night shifts, reduce clinical pressure, and move into a more structured working environment. However, the truth is that healthcare administration is not always an easy escape from stress. Instead of medical pressure, the stress often shifts towards operational responsibilities, deadlines, and workplace expectations. So while the stress may feel different, it does not necessarily disappear. One of the biggest challenges in healthcare admin roles is pressure from multiple directions. Administrative staff sit between doctors, patients, insurance companies, and management teams. Each group expects fast responses and efficient solutions. This creates a constant environment of responsibility and urgency throughout the workday. In many private hospitals and clinics in the UAE, administrative roles are strongly linked to performance indicators and operational targets. These may include patient flow, billing efficiency, insurance approvals, and overall clinic productivity. This can make the job feel more corporate and target-driven rather than purely healthcare-focused, which can be mentally draining over time. Another factor that makes admin roles feel toxic is blame culture in poorly managed facilities. When delays, complaints, or audit issues occur, administrative staff are often the first to be questioned. Even when problems are caused by system limitations or staffing shortages, admin teams may still carry the responsibility. It is important to highlight that not all healthcare admin jobs are toxic. The experience depends heavily on the organization, leadership style, and internal systems. A well-structured hospital can offer a very professional and balanced administrative work environment. Generally, larger hospital groups and government healthcare facilities provide more structured administrative roles. They usually have clearer job descriptions, better HR systems, and defined workflows. This reduces chaos and helps staff manage responsibilities in a more organized and predictable way. On the other hand, the most stressful administrative roles are often found in small private clinics or rapidly growing healthcare startups. In these environments, one person may handle reception, billing, insurance coordination, scheduling, and operations simultaneously. This workload imbalance can quickly lead to burnout and job dissatisfaction. In conclusion, healthcare admin jobs in the UAE are not automatically easier or less stressful than clinical roles. They simply involve a different type of stress. Instead of medical responsibility and clinical pressure, the challenges are operational, organizational, and sometimes political. For some professionals, this transition improves work-life balance. For others, especially in high-pressure private sector settings, it can feel equally demanding. The key factor is not the job title, but the workplace structure, leadership quality, and role clarity within the organization.